Hey guys, welcome to week 6. This week we're really going to focus on chapter 5, which is communication and athlete education. I think this chapter is arguably the most important because in order to intervene with a psychosocial strategy in your rehab or injury evaluations, you must first communicate with the student athlete why, what, how you're going to carry out these psychosocial interventions, because it's a hard thing to get them to buy into. So you know that at this point in your program you have a really good foundation of injury evaluation, upper and lower. You have a good knowledge base in thorax, modalities, pharmacology, research. You guys are almost ready to sit for the BOC and take your test. Now you need to take the next step and be able to communicate all of this knowledge and all of these skills to your student athletes. Because when you can't communicate with a student athlete, those knowledge bases and those skills that you've learned for the past couple of years, their worth diminishes. So this chapter is incredibly important now and in the future for you guys, so I want you to really focus on this chapter in this week. So at Clinical this week, I want you to kind of reflect on, and you have a assignment due called the communication self-check that is going to prompt you with specific questions. But I want you to reflect on how you're communicating diagnoses, treatment plans, rehab, interventions, how you're communicating these to student athletes. And are you having two-way communication? If you have a busy athletic training room and you only have 10 minutes, but you still have to do an evaluation on a student athlete that comes in, are you giving them the time of day? Are you maintaining eye contact? Do you have open body language? Are you kind of crossing your arms and looking over here for another athlete and then looking over here for an athlete that maybe that's doing a rehab exercise wrong? That says a lot about the patient and athletic trainer clinician trust relationship. So if I'm not maintaining that eye contact and maintaining open body language that you read about in this chapter, what message is that sending to the student athlete? So just something to think about moving forward is how you're communicating both verbally and non-verbally to the student athletes that you may be treating. Another concept that I want you to focus on in the second half of the book is paraphrasing and empathy. So a lot of times if you don't think you're communicating well with a student athlete, or they're not quite understanding your treatment plan or the why maybe behind an intervention, you could prompt them by saying, so what I'm hearing you say is, or can you help me understand better? Rather than just giving the student athlete a series of tasks or a series of diagnoses that maybe they don't understand, try maybe this week or next week when you do an evaluation and you give the student athlete the diagnosis and the student athlete responds with questions, say, what I'm hearing you say is, or help me better understand something. I think it'll go a long way and you'll get a better clinician student athlete exchange in your evaluations. The second half of this chapter is all about patient education. So this is where you guys are going to create an infographic to supplement verbal communication. So it doesn't matter to me what injury you use or what skill or rehab plan or what you choose for your infographic. It just needs to be able to supplement verbal communication. So for example, perhaps I just got done talking to a student athlete's parent about the fact that their son or daughter had a concussion. Well, I could come up with an infographic to send via email or text with at-home instructions for the next couple days for that student athlete who is concussed. So something along those lines, you guys can choose whatever you want. It just must supplement a verbal conversation you may have with a student athlete, a coach, a parent, whatever you guys want. So 4 things I want you guys to take away in the patient education portion of the chapter, which is the second half. 1, please break the information into manageable doses when you're talking to student athletes. So For example, if you're going through what an entire ACL rehab is going to look like, maybe you should focus on the front end on setting goals for range of motion and strength and breaking that portion of the rehab into a manageable dose rather than talking about the entire rehab that might be 6 to 8 months with the student athlete. Secondly, use language that they understand. I find myself quite frequently telling an athlete they have a diagnosis that they simply do not understand because they have no medical terminology background. So you'll see a table in the chapter, in chapter 5 this week, that equates an analogy like a rubber band to a ligament. And that is really helpful when you're talking to student athletes that maybe have low health literacy and they don't quite understand what may be happening anatomically in their body. Third, use written materials, which we're going to do with the infographic. I've also sometimes sent a YouTube video for someone to watch. I've given them a website. I've given them a podcast to listen to. So using written materials to complement verbal communication is really important in this profession. And then fourth, maintain two-way communication. So again, using phrases like, what are your concerns? Or help me better understand is extremely valuable. So something to try this week or next week for you guys. Do the communication self-check, submit your answers on Blackboard as well as what you scored yourself. Secondly, the patient education infographic. And then third, we do have a test coming up next week. I posted a study guide for you guys to fill out as a guide for what content will be on the test. It will be a series of multiple choice, multiple answer, as well as short answer. So please reach out if you have any questions, and I will talk to you soon.